everybody. Namaste. I am Dr. Rajveer Singh. Today I am going to discuss about tailbone pain diagnosis. First, what we do when a patient comes to us, we take detailed history of tailbone condition and its damage. How did it happen? We first examine the patient. In the examination, we check the tenderness in and around the tailbone, the muscle tightness in and around the tailbone, and is there any other associated problem like back pain, intervertebral disc prolapse, sciatica, or any other. I will be explaining in the next. After once we see the history of the patient's condition, we check whether they have the X-ray or not. Generally for tailbone, there is a specific X-ray which is called as dynamic tailbone X-ray, and that's the key diagnostic procedure in case of coccydynia. If in case after the diagnostic X-ray, that is a dynamic tailbone X-ray, if we have still any doubt, then we may go for MRI or CT scan. I am going to discuss about the dynamic tailbone X-ray in my next video, but what I am going to focus more on in this video is what is the differential diagnosis of coccydynia. Differential diagnosis means what are the other symptoms which may cause pain in and around the anus and around the tailbone, and they are very similar to tailbone pain, but it is not coccydynia. There are conditions like pilonidal sinus, pudendal neuralgia, piles, fistula, which is not bleeding type of piles or fistula. In that case, patient may get confused that it is a coccydynia. Apart from this, there is a condition called sciatica. There is a nerve which may get compressed in between the testis and anus in case of male, and vagina and anus in case of female, that is called as pudendal nerve, and this condition is called as pudendal neuralgia. Pudendal neuralgia also may get a symptom like coccydynia. So it is very important to diagnose it properly. Once the diagnosis is done, there are different parameters, different ways to diagnose coccydynia and rule out that yes, now we have come to a conclusion that this is not any other condition, it is tailbone pain. I hope this video is quite helpful for everybody. I would request everybody who is watching the video, if in case this information is helpful for you or your family members, kindly like my channel, which is Tailbone Treatment, and do subscribe. Thank you so much for watching.